was ready to blow me down.
What's up, guys? Welcome back to our channel.
Thank you guys so much for tuning in to the series Nursing in a Nutshell. As you guys know from the last video, we talked about the beginning, the first start as a nurse, the choices that you can choose.
Right. On this video, we're going to be talking about... Today, we're going to be talking about the nurses who are already in school, who went through the whole process, and you are now either in term 1 or in term 2.
Getting your feet wet, getting like the hard test going, you know? Yeah.
So we want to give like tips that we wish we would have known in the beginning. Sorry.
She's really caring about the tips. Yeah. She's gonna cry now.
Tips about study. At that point, you might be going to clinicals already. So we want to give tips about how you can prepare yourself for that. You
guys might be in, I mean, it goes different from every school, but you guys might be in pharma, you might be doing A&P, and guys doing nursing fundamentals. So we'll talk about, you know, each of those things and kind of study tips around those ways, right?
So for us, for our term 1, we were definitely very overwhelmed in the beginning. We didn't know how to study, and that studying and knowing your method is the most important part in term 1, because that's going to follow throughout the whole term, and that's going to make you be successful with your tests, your studies, everything. That just dictates how it's going to be.
But I think one of the things, before we continue on that, is if you have been rusty, like as in out of school. Like when I went into nursing school, I was probably a year out of school. So I didn't get any kind of like, you know, repetition of, you know, studying, taking notes, or getting prepared for tests, you know? So there might be other people out there that maybe you haven't gone to school in like 6 years. It's gonna be a grind. It's gonna be a struggle to get that process back. But what we're gonna talk about is tips that you could take now. You can start now to get that balance.
Like, these are just some ideas we're gonna throw out there that worked for different people. For example, me, I'm a very visual person. So no matter if you tell me 100 times what the topic is, what it's about, all that type of stuff, my brain is not gonna capture it. Like, I will not understand anything you're saying. So for me, I have to draw. I have to either draw diagrams, or I have to write like a bunch of papers, a bunch of notes, and I'll read it back to myself. Or I would even like write little cue cards and, you know, write the topic in the front, and then on the back I would write the answers to them, or side effects for, let's say, a disease or something. I would write it on the back. And that's a way for me to memorize. Like, to help me do it, I have to do that.
But one thing crazy about Liz is when she remembers something, it's never forgotten. When she sees it one time, like, she learned how to put a Foley catheter one time, and that was just bam. Now she doesn't even need any training for it all, and she did that with every kind of thing.
But
so these are different, you know, different kind of people out there. Like, she's one of those, you know, super smart.
No, but for me, as long as, like, for example, I am the type, I was a huge nerd. Let's just put it out there. I still am. But in school, I was that person that had a bunch of highlighters, a bunch of pens. I even had a Rolly backpack.
She had a Rolly.
I had a Rolly backpack, and I didn't care. I was
Who remembers Rolly backpacks? You remember that?
Because once you start, you're gonna realize the books are this thick, no joke. Like, you have so many books, and they're very thick.
I had to work out every day.
I know sometimes some schools are electronic. They went to electronic stuff. Yeah.
Why weren't we on that?
We were the old ones.
We were the old ones.
But maybe some other schools are so kind of old, so they still do books. So yeah. Point is, I had a Rolly. And then I would highlight my stuff. I would highlight my whole book, and I would read it 2 times usually to really understand it. And once I got the idea and the message, I would never forget it. I just always remembered it. it's just, you get it once you start studying for it better. Once you start studying for it and you get your method, you will never forget the information. You know?
I wish I had that. I wish I had that. For me, let me tell you my experience. I'm not the smartest. So, what I would do with my classmates, or in the beginning it was just me, I would basically, whatever chapters we had in for a quiz or a test at a certain point, is I would make a study guide. And that's literally going through the book and bringing out the main points and putting them on one Word document. Then I would go back, print them out, and I start highlighting different keywords. And if I kept looking at them, I would pray that I would remember some. But, you know, that kind of style is not for everybody. It worked for me, as in I just kept repetition, reminding myself, okay, this is what the topic is about. This is the main points highlighted and everything. You know, and there's plenty of other things. You know, a lot of people were recommending, you know, watch YouTube videos. There's a lot of YouTube channels that are actually like educational videos that show you like, that teach you on an actual scientific level.
Right, because I know some books or even the teachers, they explain it in a way where you still don't get it. So there are YouTube videos out there that I definitely use, you know, he used, that go over specific topics or diseases, and they explain it like step by step, and they really work.
Who's got those teachers that say, look, it's not gonna always be in the book, you gotta look outside the box?
Yeah.
Outside the box meaning they don't tell you any website to go to that maybe they're getting a question out of, but you gotta find it.
Right.
So
that's why getting your own ways of how to study, it's so important, because a lot of the times you're gonna have to do it on your own. Like some teachers, and this is just a reality, their teaching methods just sometimes don't work, or it just doesn't work for you, and it might not work for you for the whole term because you're stuck with that teacher. So you're gonna have to teach yourself a lot of the times.
And I think another one of those kind of like study tools that some people do that work is teaching somebody else who doesn't know anything about it,
right,
how everything works, whatever chapter you're on,
right,
or whether you're on like a subject in pharmacology where you have to explain medication. Figure out some way where you could actually explain it to somebody who, not even in the nursing field, whether it's your parents, your friends, or somebody.
Because once you get to that point, if you're able to explain it and teach it to someone else,
right when you see that, you're gonna be like, damn,
you know the topic, like you're good. So that really helps a lot. Be the teacher, and it will stick with you. So next topic we want to talk about also another little tip. Usually for anatomy, because sometimes you get anatomy and physiology in term 1 and 2. What I would do, because again I'm a writer, I would literally put on my cue cards the part of the body, and on the back I would just put like what's it for, why would it help, like literally liver, and then the back I would just write down what it's for, what it helps, what it produces.
Because those ones, that is...
Make sure you really get that down though, because that goes throughout the whole term.
It goes from term 1 to term 4, because you're going to need to know the placement of where your organs are and your bones and everything and how they work together. So if you think that, A&P is just A&P and I'm going to just go by it, and if I barely pass, it'll be okay. It's always going to come back. This is why it's called like the beginnings, the anatomy and physiology, the nursing fundamentals, because these fundamentals are the things that are always going to be carried with you throughout everything. Because when you go back down to the root of everything you're learning,
it's all about fundamentals.
It goes down to the beginnings of your body. So you know,
make sure you get your fundamentals down. Like everything in fundamentals, literally, those are your core nursing stuff. All of it in term 1 or 2, depending on how your school does it. But get that down. Also, I know some schools use a new system called ATI. My school got it towards the end of the term, but now everyone in the beginning gets it too. So from term 1 up to term 4. And I used it for, again, my last terms, but I wish I would have used it in the beginning, because that also really helps. Like it has like little tests that you can do to whatever topic you're at, or if you take a test and you got it wrong, it tells you like it's a lot of work. It is. It tells you like a whole summary and a whole page of what you did wrong and why. So if you do have that system, really use it. Like, use it to the fullest advantage, because it really works. ATI really works.
Well, I think adding on to that is just the main thing is be proactive in a sense that, like what she mentioned, ATIs. A lot of the things that your teachers tell you, oh, maybe you should start reading ahead, or maybe you should start answering questions now for your exit exam, or getting ready for your NCLEX or whatever. Take those to heart.
Right, because
we never did that.
Time flies.
Time flies, and you think back, and man, my teacher from term 1 told me to start studying and doing questions.
Yeah.
But now it's game time, and
It's
I don't
like-
have that much time.
Right.
So always be proactive. When you first come out the gate, always be ahead. When they tell you to read ahead, look, you're gonna have a test in 2 days, but here's the next topics. You want to read at least one time, because you do not want to be behind. Because if you're behind,
you're always gonna kind of be behind.
Yeah,
you're
you're
gonna try
gonna be
to play
behind.
catch up, and you never really can.
But we say that, but that's not to say do not be discouraged if you get a bad grade. We've always had bad grades, but those don't make or break you, because you always have so many opportunities.
You can always bounce back from that.
Yeah. You have your finals towards the end of the terms and all those kind of things that you put all together if you really work for it. You just change your,
And if, let's say, you do get a bad grade, get help. Like, if you don't understand the topic,
ask questions.
Ask questions. Don't be scared.
Your
Don't be
teachers
shy.
are your resources.
Or if you are shy, like I was really shy,
you could put it on a piece of note and slide it on the desk.
I would wait until everyone left, and then I would talk to the teacher privately, or when the class was over and the teacher would go off to the office, I would follow the teacher, and then I would ask the teacher a bunch of questions.
So,
So there's ways, if you're shy, if you're not shy, ask questions. Make sure you know your topics. That's really important. Because if you don't know a topic, do not move on to the next chapter and try to catch up.
Or it's going to be like this cycle of like, it's going to stack up on you. Oh, I don't know this, I don't know this, I don't know that.
Exactly.
And then it's going to come right back to you later.
Every topic, every chapter you get, try to understand as much as you can. And just ask questions. It's okay if you don't know. We're not perfect. We don't know everything. We never will. So, ask questions.
Yeah. And on top of you guys probably being in school, getting the experience of a nursing quiz or a nursing test exactly the next day, or saying in your mind, oh my God, I'm reading 5 chapters tonight and I have a test tomorrow.
Because that will happen.
Is that possible, bruh?
Bruh.
Bruh.
But you guys probably are also going to clinicals. Clinicals are a big thing.
You started in term 1 clinicals.
Yeah, like
There's kind of
towards the end, right?
half of term 1, you start doing your clinicals. Yeah. Clinicals are a lot of fun.
If you make it.
Right,
if
you make it
you
fun.
have the attitude of you wanting to learn,
right,
and you want to be a sponge and take in all the information,
which
it will be fun
have
for
to
you.
be. You have to be a sponge.
Yeah.
So we want to give a few tips about clinicals too, because clinicals are just as overwhelming as your theory classes can be, because these are people who are already in the work field, and these are actual patients that you're not going to be taking care of, but you're going to be assisting.
Yeah.
And eventually, throughout your terms, you will be getting the full care for several patients.
You might have not even experienced walking into a facility. You know? The nervousness, the anxiety that you're getting, that, we're doing clinicals 2 days this week. I don't want to do it. Right. Or waking up early. School starts later, but clinicals start early.
Right.
So
it just depends on your school. For example, for mine, it would be divided. So one day it was just for clinical, so we wouldn't even go to theory. The next day we would go to theory. So it just depends on the type of school you're into. So my first tip for clinicals is be prepared. You don't want to go in there not knowing what you're gonna do. Like, for example, usually in term 1 or maybe even in term 2, you start doing CNA work. You work with the CNAs to really get yourself out there, get the fear out of your system.
Yeah, learn the process of
cleaning,
making
beds. It's so
changing them. That one Those were the days right there.
Yeah, those were the days.
Cleaning.
It's not like they say it's like making your own bed at home, but it's a little different because there's a lot more things to add up on the patient's bed. But yeah, usually you do that type of work in the beginning with the CNAs. Right. And you know, that is the core too. You have to really get yourself out there, get your hands dirty with the CNAs because it's gonna be with you forever. And
always that when you do clinicals, literally being with the people that are willing to teach you are the ones that you want to stick around with.
Right.
And you want to mess up now. You don't want to mess up in the real world. You want to mess up now when you have a teacher there to help you and correct you.
Because usually you're partnered up with a CNA. So you're with them. You're not alone. You're going to be with them and they're going to be telling you what to do and helping you. So, you know, when you do get a patient with the CNA, my advice for you would be before you even do anything, try to know who the patient is. Like, go to the chart. You know, you're a student. You're allowed to go to the station and get a chart, or if it's not there, ask. Never be afraid to ask. So, you know, look in the chart, see who the patient is. If it's even a male, female, learn the basics. If you're not even knowledgeable about what a diagnosis is and all that, then overlook that.
Go ask.
Ask if you really want to know, or just overlook it and just look at the most basic things. Are they Hispanic, or what ethnicity are they? Like,
what do they prefer?
Exactly.
You want to ask. Like, some people don't want, you know, women or men to be taking care of them. So you want to be careful of who you enter the room with, and if
you're like, oh, you know, actually you partner me with this patient, but they actually don't like males, they only want females.
Everyone makes mistakes, so they could be like, oh, okay, let me go give you a different patient.
Exactly. You know? So that would be the first advice. Just always be prepared. Know who you're going to help with, and always be proactive about it. Always. Never settle. Also, don't be offended if there's some CNAs or in general LVNs, whoever you're partnered with, if they don't really want to teach you.
Yeah.
Or if you see them and someone tells you, oh, can they follow? And they're like, no, like, I don't want students and stuff like that. Because that will happen a lot of the times. You're going to get that everywhere, but don't be offended by that. Because keep in mind, these are their actual jobs. And they might have a lot of patients, a lot of work. And now they have to have someone else come in and teach them. So some of them just don't have the patience for it. So don't be offended by that. You know, that didn't happen. They have a bad attitude.
You got to adapt.
Fine.
The main thing is you have to adapt. You have to adapt with your environment, because you're going into their area, their space. It's not you, they're coming into you, you know? So you want to be on your best behavior. Even if there's attitude there, you got to be nice, because that goes a long way. A lot of things can be said in a facility. A lot of things can spread, and you might be already looking
not that good.
Yeah, not that good in front of the DON.
Right. Keep in mind, just because you're a student, that doesn't mean they're not watching you. Everyone is watching you. So let's say you're the type of student that wants to, if that CNA didn't want to work with you, you see another CNA that's a little more friendlier, you can ask your teacher, can I go with that CNA? You know, it looks like the CNA would want to help me more. Sure, go, you know? And then that CNA is going to start talking to everyone like, oh, you know, the student is like really helpful. They're going to start to like you. And who knows, maybe when you graduate, you're going to want to work there, and they're going to remember you.
Connections go a long way.
Connections, guys.
Who you know, who you're nice to, and who you leave a lasting impression on.
Yeah.
Those all help.
They all help. So make connections. Even in term 1, once you're starting, always make connections. Have a smile on your face. Be positive. Always. That's gonna help. So then another part that was really hard for me, well, both of us, was even talking to the patient. Like the jitters of even having to say hi. That's a lot of anxiety,
being like, man, I'm gonna have to go into a room and speak to somebody. You know, those are one of those things where you learn it as you go, but we want to help you along, so maybe it gets easier, quicker. You know, so it's different for everybody, but you know.
Yeah, it's different. So, you know, something, make it really quick. Don't make it so wordy. Don't overthink it. You could just be like, hi, my name is so-and-so. Like, my name is Bob.
So Yeah, and the
my
patient
name
is
is
firm.
Bob, and
you
the
know?
patient, my name is Bob, and I'm gonna be with your nurse, Alice, assisting you in whatever you need. I'm gonna be taking your vital signs. Is there something I can do for you, or
And Liz
are
made
you
a good
feeling
point.
okay?
You want to say it.
Yeah.
You don't want to ask it as a question, because patients who are there will always say no. They will, if you give them the option to say something, they will.
They will.
You got to be kind of firm with it.
firm,
it's hard.
but tender.
Yeah,
and
tender and firm,
gentle.
saying like, I'm gonna be doing this for you.
Like,
Not can I, may I, because those are questions you're giving them. They have an answer to say yes or no.
No.
Or no, I'm
Then it has
sleeping. Or
happened.
no, I'm doing something.
Exactly.
Come back later. And that's the problem I used to have. I used to have those questions where I would ask them. They would say no, I'll go back to my teacher. And they would be like, why did you ask them? That's where you went wrong. Maybe go back in there and tell them. And then once I told them that I was going to, they got mad at me. The patients got mad at me because I bothered them again.
Yeah.
So you want to stay ahead of the game, in front of them, saying that you will do this.
Right.
Just,
I'm gonna take your vital signs. How are you doing? Make conversation with them. Don't be scared to make conversations with them. Get to know them. You're gonna be probably having that patient for a while, because you're gonna be at that facility, at that place for
you want to get
your
that
term.
feeling of anxiety away now.
Yeah.
Because it's gonna get worse if you don't. Because when you get to term 3 and term 4, you're going in there with medication. You're knocking on that door. You're closing the curtain, and it's one-on-one.
It's perfecting time.
You are talking
at
to
those
them.
terms.
So you want to get that 1-2 right there. Let that anxiety go away, and then let your anxiety kick in when it comes to the med pass or whatever.
Exactly. So always be proactive. Don't be scared. Be upfront. Be a little firm but gentle, and just go for it. You're gonna make mistakes. That's perfectly fine. That's why you're there to learn. Making mistakes, term 1 and 2.
We all make mistakes. We make mistakes, but hopefully, the tips that we gave, gives you guys a little more help.
Right, get the jitters out. And it's okay to be overwhelmed and scared. That's perfectly fine. But get it out of your system, term 1 and 2. That's just, our advice.
Yeah, our advice. Take it with a grain of salt.
Yeah.
Anyways, that's gonna do it for this section, this topic. We hope you guys enjoyed the video. Thank you guys so much for watching. This is Life with L&R.